Hi, I'm Dr. Kevin Brewer. I'm a dentist in Billings, Montana, and we're doing a video on brushing and flossing, basically home care. And I want to make it as easy as possible because a lot of my patients aren't doing as good a job as they could, and if I can help them in any way, I would like to. Even as a dentist, I probably wasn't flossing until I developed a particular pattern. One of the secrets to getting this done is actually doing it in the shower. I think the one time that you've got that you aren't afraid that you're wasting time is in the shower. And so I'm going to advocate brushing in the shower. For me, that means morning. We're going to talk about brushing and flossing. I've got a particular tool that I like to use for the flossing. If we do one before the other, I think it should be flossing ideally, but I'm going to start with a teaching of the brushing. And the pattern is what's important. People use a timer in certain instances, in certain training. I'm not into the timer. I'm into brushing and flossing every side of every tooth, at least once a day, ideally brushing after every meal. First of all, I want the toothbrush to be at a 45-degree angle to the tooth and gums. Those bristles should be pushed in there firmly. So basically we're very, very forcefully scrubbing, like we're cleaning a dish or an auto part. You know, it's just virtually scrubbing like there's filth on there. And if you've got some gingivitis, those gums should be bleeding. And another great way to take care of the blood, you're in the shower. So down the drain it goes. You have to be meticulous about home care for 2 full weeks before that bleeding will stop. You probably need a professional cleaning if you still have bleeding after that. So professional cleaning and then 2 weeks of really thorough maintenance. So after going all the way around the outside, we're going all the way around the inside, scrubbing a few teeth at a time. And you'd spend a little more time than I'm spending, obviously. But if you're really, really good at what you're doing, it doesn't take long. And that's the thing to remember. So pattern brushing, and then you neither overbrush nor underbrush. Now after going all the way around the outside, all the way around the inside, then I'm just going to use a power stroke here. We don't like the power stroke because it can abrade the gums and the necks of the teeth. That's why more of a circular scrubbing motion. But on the tops of the teeth, I'm not worried about the abrasion. The power stroke's great. After completing the upper arch, we do the lower arch. Once again, very, very defined pattern. All the way around the outside. Then it's all the way around the inside. When you get to the bottom front, the brush doesn't really fit that way, so up and down is the best. And then all the way around the inside. Once again, finish with that power stroke. You'd be spending a little bit more time than I am, but not much. If you know what you're doing, it's quick. Now what makes the flossing the easiest, in my opinion, is Reach. This is a Johnson & Johnson company, and it's called Reach Access. And I totally believe that this makes flossing easier. You kind of bite it into place, and once again, you'll do it in a very, very defined pattern. So it's placed. You can actually clean the back of the back tooth that way. You can bite it into place, and then you clean the tooth in front, clean in back, and then you bite it into the next location, up and down, and so forth until you're all the way around the outside. Then you repeat it on the bottom arch. Once again, you can clean the back of a tooth, you slide in between, and you're pushing against one tooth and then pushing against the other. Very defined pattern so that no areas are missed all the way around the outside. For those of you that would like to floss the old-fashioned way, in my opinion, 18 to 24 inches of floss wrapped around the middle finger and the middle finger. The reason that is because then the index fingers can be used. Thumb and an index finger, 2 thumbs, but basically you're sliding between 2 teeth, you're wrapping it toward one tooth and scraping up and down, wrapping it toward the other tooth up and down. Once again, the secret is a very defined pattern. And once again, we're recommending doing this in the shower. It's the one time, after work and taking care of a family and eating and dishes, you're just too exhausted. So I'm totally advocating doing it in the shower. If the gums are bleeding, it means they need more attention. It does take 2 full weeks of meticulous care to get that bleeding to stop. I am recommending adult and child cleanings minimum of every 6 months. So let's make sure we're getting that done, and then meticulous home care. Gingivitis can contribute to heart disease, so keep in mind we definitely need you to be on top of that. And healthy gums, healthy heart, and that's my message. Do it in the shower. Thanks.